Hello everyone, I'm Michael Serapio. British Columbia's pilot program to decriminalize some illicit drugs was front and center in Parliament today. BC wanting to roll back provisions that allow for public drug use, but the federal government, which needs to be involved, has not taken what Conservatives describe as immediate action. The official opposition did ask for an emergency debate on the issue. It was denied by the Speaker, so now Conservatives are demanding the government allow for a take-note debate.
Worse than refusing to take immediate action, the government has refused to rule out expanding this dangerous and extreme pilot project to other communities, most notably in Toronto. So they're refusing to rule out expanding this deadly policy to other communities in Canada. And that is why Conservatives believe that the Trudeau government needs to be held accountable to parliamentarians and are calling on the government to grant this emergency take-note debate immediately so that Canadians can hold this government accountable.
Joining us now are Brendan Hanley, Liberal MP for Yukon, Laila Goodridge, the Conservative critic for addictions, and Gord Johns, who is the NDP critic for mental health and harm reduction. Hello to the three of you. Listen, Laila, I'll get you to start us off here because it's your party that's calling for this take-note debate. You know, why not just give the government time to react to BC's request? That meeting took place the end of last week. Why not give this a bit more time?
Well, frankly, it's been a year of a pilot project in British Columbia that we've had some very devastating responses coming out of. A couple weeks ago in Health Committee, we heard very clearly from Fiona Wilson, the Deputy Police Commissioner, that they did not have the tools they needed to be able to deal with the addiction crisis and support communities and community safety, and this is incumbent on them. British Columbia has already tried to bring forward their own legislation, have had it now caught up in the courts, and so they're asking the federal government to bail them out, and the federal government taking their time waiting and forcing more Canadians to die, this drugs and disorder to continue is absolutely not acceptable, and they deserve to answer directly to Canadians as to why they're delaying.
Okay, Brendan, let's pick up on Laila's point there because, you know, it is true. The BC government did try to put their own limits on this. It's backed up in the courts. And the province is now asking for Ottawa to provide this exemption. And the nurses union in BC say it's necessary. They say that their patients rather, are in danger. Why hasn't there been more immediate action?
Well, you know, when an exemption request came just at the end of the week, the ministry obviously has to consider that request, and I'll really leave that for the ministry to follow due process and consideration of Premier Eby's request. What I will say, though, is that there are really two issues here. One is the concept and the practice of decriminalization and allowing time for a pilot to take place, and the other is about public consumption of drugs and the public nuisance aspects of consumption in public places. And we have to be careful not to confound those two. Clearly there's a relationship, but many of the problems that were identified and are very real problems are not inherently problems of decriminalization itself. So we need to, you know, there are nuances here. We need to take some time to really consider this carefully.
Okay, nuances, I take what you're saying, but, you know, one does come from the other. So when will there be action? Because, you know, nuisance is the word that you use. Public safety is the terminology being used on the ground.
So we've just come from committee. All three of us were in committee hearing further testimony on a number of aspects of this terrible crisis. What is real is that 21 Canadians are dying a day, seven a day in BC. This is a critical problem. We have to address this in the interests of Canadians and lives of Canadians, and the safety of the community at the same time.
Gord, I'm wondering what your take is on this. How well has this pilot program gone when drugs are being consumed in public spaces? You have a union saying that they can't do their job, people talking about feeling a sense of danger. How well has this program gone?
Well, I think first we can look at the numbers themselves. I mean, we've seen an increase in toxic drug deaths in British Columbia go up 5%. In neighboring Alberta, they're up 17%, in Saskatchewan, 23%. Over in Alaska, just north of us, it's gone up 45% year over year. Those are provinces and states without harm reduction, without safer supply programs or decriminalization. I think we need to push the jurisdiction aside and pull the politics apart and look at evidence-based policy and best practices. And we heard from Fiona Wilson, the chiefs of police for British Columbia, and she was unequivocally clear that going back to criminalizing people is not what they support. They see a health-based response to this crisis. They also were unequivocally clear that diversion of safe supply, despite the Conservatives spreading that disinformation, is not what's killing people. It's deadly fentanyl. They called for more safe consumption sites, more affordable housing, scaling up and ramping up treatment on demand, recovery, prevention, education, things that the NDP has been calling for and was identified in my bill C-210 to have a health-based response to the toxic drug crisis. So I think we need to evaluate each policy and look at it in a whole context. But right now, I mean, any increase in deaths isn't good. And my heart goes out to the families, and we need to do everything we can to stop an increase in deaths. But we also need to make sure we're listening to evidence-based policy, not ideology.
Okay, Laila, let's pick up on that. You know, is there not some merit in a program, you know, taking some time to get it right, but a program that is, by many accounts, saving lives? Because, you know, BC is not throwing the whole program away. What they're asking for here is tweaks.
They're asking for a wholesale change. This is a massive change that they're asking for that the federal government has yet to say whether they will even entertain. So I think that that's an important factor to push out there. And so people in BC woke up on Saturday thinking that public drug use was now going to be illegal again. And surprise, it's not. You can still do everything that has been done before. We've heard horrific cases of public drug use in hospitals, putting people's lives at risk, putting patients' lives at risk, putting nurses' lives at risk. There was a young nurse who was the mom of twin girls who stopped breastfeeding her child because she was subjected to so much toxic illicit drug fumes in the workplace that she didn't think that that was going to be safe to continue breastfeeding her child. As a mom of young children, I can't imagine being put into that situation by my workplace because my government put forward a policy that it was not ready to put forward, that was absolutely broken and is putting this many people at risk. So I reject the fact that this is a small change that the government is asking for. They're basically asking the federal government to bail them out of the mess that they asked for.
You know, Gord, we all only have one opportunity to make a first impression. And I'm wondering if this pilot has gone badly enough, because there are a number of critics, that it can actually be recovered and saved.
Absolutely. I mean, we heard loud and clear from the BC chiefs of police that they wanted more tools to be able to move people along and in extraordinary cases, they would criminally charge them. But they were unequivocally clear that they don't want to go back to criminalizing people who use substances. It causes more harm and it doesn't work. So I think we can look at what the police have been saying and other experts, and we need to ramp up our response in everything from treatment on demand, recovery, prevention, education, and yes, safer supply. The Liberal approach has been incremental, which is, costs lives in a health crisis. The Conservatives spread disinformation, and that's deadly in a health crisis. What we need is the government to act like it's an emergency. They haven't declared a health emergency. They haven't had a summit on this crisis like they did on the auto theft summit, despite the fact that this is the leading cause of death for people under the age of 59 in my home province. And they haven't reinstated the expert task force, which they responded to my call and question period today that they would. But they need to act like it's a health emergency. They've spent less than 1% in responding to this crisis than they did COVID-19. And it's because of stigma, purely because of stigma.
Okay, you know, Brendan, obviously you yourself noted that there are at least a couple of things going here. One has to do with the public drug use. The other has to do with the theory of trying to decriminalize drugs for better health outcomes. A lot of issues which, quite frankly, a take-note debate might be able to clarify it for Canadians. Will your government answer the Conservative call and let a take-note debate happen?
Personally, I don't have a problem with having having a debate. What I want is for the public to be as well informed about this crisis as possible, and to know how this involves almost every family in the country is affected in one way or another. I come from a small jurisdiction, the Yukon, of course. We only have 40,000 communities. We have an unacceptable rate of death. We have to look at all options to address this crisis using the broader four pillars, and we have to learn from our experiences. We have to not doing anything, leaving the status quo of criminalizing drug use is wrong and has been and is a risk in itself. So we have to learn where we have unexpected consequences, readjust, and one jurisdiction, one community learning from another. So that's the way ahead. I'd be happy to participate in any level of debate, whether that's in the House or at committee level.
Okay, you are, but will you press your government to do that? Because Conservatives are pressing your government to actually have this take note debate.
I think, again, the ministry has taken the request from Premier Ibida, and the minister will be considering that request. And
but the take note, the debate, though, not the BC request, but the take note debate being called upon, the Conservatives are calling on your government to bring about.
This has been a crisis since 2016. So whether and in fact, it was the year before last that I called on the House to have a take note debate on the opioid crisis, and we had. I think there is time to reconsider that. Whether that's this week or next week, we need to keep these discussions going. This is why I brought the study to this committee, to figure out the best course ahead to address this very complex, very distressing crisis in all its aspects.
Okay, Laila, I have about a minute left, so I'm going to give the last word to you because, again, your party's calling for this. Why do you think this take note debate is important?
It's absolutely crucial for Canadians to hear very clearly where this is at. Today, so it's funny that Brendan says that he supports this. I brought forward a motion at our health committee to have the Minister of Mental Health and Addiction, as well as British Columbia's Minister of Mental Health and Addiction, come to our committee to talk about this very issue, and they voted. The NDP Liberal Coalition voted to shut down the debate on this and not to have that vote because they don't want Canadians to hear. And so Conservatives are going to continue pushing. We need to have these conversations. We need to have this debate in the House of Commons because Canadians deserve to have these answers. We're hearing horrific, gruesome stories coming out of British Columbia from the absolute chaos and crime that is on the streets because of pure public disorder in the drug use. This is not about stigma. This is about, it has become a Wild West of everything goes because we have not had the tools in place to actually have something put that is actually logical. And this is a serious problem. And Canadians are demanding answers. And what makes matters even worse is the Minister of Mental Health and Addiction stood in the chamber today and refused to say that she wouldn't go forward with Toronto's request to do this. So we have one jurisdiction saying, whoa, this is a bit of a failure. We need some help. Bail us out. And the federal government is saying, but we're still going to go down and look at the request coming from Toronto. It's a completely different situation. Well, it doesn't make sense. This absolutely doesn't make sense, and this is just indicative of what this government has done on this file, where they try and distract Canadians and push them away from what the real topic is. And Canadians are brilliant, and they understand that this is an absolute crisis. This is a public health crisis, and we need to deal with it as such, and we need to prioritize treatment and recovery, and Conservatives will do exactly that. We have been pushing forward our message on treatment and recovery, and we'll continue doing so because Canadians deserve to know that the government will stand up for them, and we believe that they can recover. People do recover.
Okay, and I apologize we're out of time, but obviously the request for this take note debate happened late today, so we'll follow it as the week goes on. Brendan Hanley, Laila Goodridge, Gord Johns, thank you very much for the time this evening.
Thank you very much.